Hi, I'm Tom Lynch. Two things. Today I'm delighted to be joined by Katrina Armstrong, our Jackson Professor of Medicine and Chief of the Medical Service. Katrina, some people think in academic medicine that July is the best part of the year. We welcome our new residents. How are things going so far with the new charges?
Well, so it's been a fantastic beginning of the year. We have amazing new house officers who've come to us from across the country, Tom, from medical schools across the U.S. as well as from 4 other countries. They've hit the ground running. It's an incredible time at the MGH with the excitement levels and the enthusiasm across the medical services. I do think at the highest point during the year.
So one of the questions is, we understand there's going to be a big reorganization of the medical service around the establishment of the McGovern Service. Tell me a little about what is the McGovern Service?
One of the things we've taken on over the last year is to really think about the values on the medical service and try to articulate what we're most importantly, what we are trying to achieve for our patients. And actually, with the new house staff now, we have an entirely redesigned Bigelow service that actually no longer has a private service and is really focusing on the teaching service as the culmination of our educational and clinical missions. But we've also reaffirmed our commitment to individual outpatient continuity providers caring for their own patients within the hospital. We've called that the McGovern Service after Marion McGovern. And David Finn has a fantastic group of people who are working closely with him to create plans for how we're going to support that for our patients and our providers, particularly primary care providers, but also for specialists who take care of their patients when they're in their outpatient practice, but also then follow them into the hospital.
So Katrina, this is more driven by the patient's provider rather than necessarily the disease. There can be diabetic patients or heart patients or cancer patients or liver patients on the McGovern service.
Absolutely. So the idea really is that we want to support the opportunity for physicians to continue to be able to take care of their patients in their practice, but then also follow those patients to the hospital.
And we still want to also encourage continuity visits for outpatient primary care doctors and outpatient specialists whose patients are on one of our more established services.
Absolutely. So the connection between what's happening in the hospital and what's happening outside of the hospital, whether in their practice or their home, is critical to achieve the quality of care that we need to achieve.
Katrina, thank you so much for your leadership of the Department of Medicine and for these changes. I think it's a great effort to make the MGH inpatient service absolutely spectacular and terrific. I'm Tom Lynch, and that's Two Things.